Looking at diagnostic ultrasound imaging, this is a really interesting imaging modality because, as we're going to see with the live Blackboard Collaborate session, ultrasound has become very cheap, very accessible, and also very integral to MSK imaging and physical therapy practice. So we're definitely going to take a long look at ultrasound imaging because I think this is one of the imaging modalities that we really can use clinically. And we're going to see that it's not going to involve any sort of ionizing radiation, and it is very cheap to administer. So I think the thing we really need to look at as physical therapists is how we're going to integrate this into our practice and really practice at the top of our licenses. So taking a look at the objectives of this course, so what I want you really to get a sense of is the basic process of an ultrasound image acquisition. I'm going to suggest throughout the slideshow that you pause the video if something doesn't make sense. You go back, you review, you rewind, whatever you have to do, because this is going to have a little bit of a learning curve to it. So just understand and realize that ultrasound has a lot of benefits, but at the same time, you really need to know your anatomy intently and then need to be able to transpose your knowledge of anatomy to what is actually happening on the ultrasound screen, because there's a little bit of a spatial difference, if you will. So diagnostic ultrasound is basically based on tissue absorption of sound waves. We're very familiar with this when it comes to therapeutic ultrasound. And also it is based on the reflection of sound waves. And we're going to get into what the difference between each of those is. Like I said earlier, this is a non-invasive, non-ionizing, very inexpensive, very quick way to get a good image on an individual. We're very commonly aware of this in the context of OBGYN. Obviously, this is a nice way to view what's happening with a developing fetus. And what we're seeing is that with the advances, and especially the advances we're going to see in the live Collaborate session, this has a lot of use. So what we're going to use this for is to evaluate lesions in muscle, tendon, and ligament. We can also look at things like rib fractures. It is very good for the detection of cysts, whether it be a ganglion cyst or a Baker cyst or something of that nature. And then in terms of measurement of blood flow, like a Doppler study, we're also very familiar with this. So if we really think about this, if someone, say, has a positive Wells prediction rule, this can be a very useful tool in actually measuring whether or not that person has a restriction in blood flow, and really could save that person a trip to the emergency room or be able to better accurately diagnose them with potential deep vein thrombosis. So taking a look at the advantages, the joint can be placed in different positions. That's a huge advantage. If we want to view the knee, we can place that knee at 0 degrees of flexion, 30, 60, 90, 120. We can take a look at how the patellar ligament or patellar tendon acts, or how the quadricep acts when that knee is placed at different angles. We can take a look at how the shoulder looks at different angles. So this has a lot of more live applicability. As I'm going to show you in the Blackboard Collaborate session, we can actually watch muscle contract. So not only is this really nice for things like imaging or the screening for pathology, but also things like biofeedback. So our patients can get a good sense of, hey, I'm actually contracting that muscle because I can see it. Like every imaging modality, there's a lot of limitations. The big one is this takes a lot of skill. I'm going to tell you, I have practiced with the ultrasound machine that we purchased as a department for a long time. I would highly recommend practicing a lot before you actually start utilizing it in the clinic. Ultrasound, we have to remember, is not going to penetrate bone. So as we're going to see, the ultrasound is going to reflect against bone, and we're not going to be able to see anything below the bone. So we're just going to see a dark space deep to the bone. Larger patients are not going to be very well imaged because there's going to be so much energy lost in subcutaneous fat tissue. And technically, we're still not able to diagnose as PTs. So this is the old school unit. This is the older unit that we actually have in the department. This is what we're very familiar with ultrasound. So what we have is we have a pulsar, we have a transducer, very similar to your therapeutic ultrasound units. The only big difference is that we're actually using a picture, and how we use that is we actually use a much higher frequency than what we're used to. We're used to ultrasound being at 1 megahertz up to about 3.3 megahertz. With diagnostic ultrasound, we're actually going to go up to 15 megahertz, and in some cases 21 or 22 megahertz depending on the machine. So we actually are going to use a lot higher frequency ultrasound because we're going to do a very different sort of ultrasound, obviously what we're used to. This is an alternative version. This is kind of the version from about 10 years ago. So smaller, more portable laptop style version. As you can see, this is a lot easier to port between patients. This is a lot easier to use in multiple settings. This is the type of machine that when I was first introduced to ultrasound, this was the hot one on the market. So there's a lot of good to this one. This unit runs a little more expensive than your average unit now. So this one's going to run somewhere between 8 and 10 grand. But as we're going to see, the technology has gotten so good that we're actually able to purchase ultrasound machines for a lot less money and have actually more accessibility and portability. This is a version of the current one on the market. So the one that we have purchased is called Butterfly IQ. And as you can see, it is an ultrasound unit that plugs directly into an iPad or an iPhone. So I will show you guys our unit on the live Blackboard Collaborate session, and it literally plugs directly into my phone. So what we're able to do is we're able to get a very good picture via ultrasound that will display on an iPad. It's very easy to use. I will tell you, it took me about 5 minutes to get it set up. And it's very nice because there's a lot of presets and there's a lot of things that ease the barriers to implementing it in clinical use. So terminology. 3 big terms here. These are very similar to therapeutic ultrasound terms. Absorption, refraction, reflection. The big ones we have to understand are that some tissues will absorb ultrasound energy, some tissues will refract that energy and beam it off at an angle, so it distorts the view a little bit. And then reflection is what's going to happen when the ultrasound hits a very solid surface. That solid surface could be bone. That solid surface could be something like a piece of metal, like an ORIF. And we're going to see that we're not able to see anything past that. So 4 more terms. Echogenicity, ability to bounce a sound wave. Okay, so what we're going to see is we're going to see that some tissues are hyperechoic, so they actually have a greater amplitude of echo than the surrounding medium. Some are going to be hypoechoic, and hyperechoic is going to show lighter on an ultrasound. Hypoechoic will show darker. Anechoic means that there's no echo happening. That's what's going to happen deep to the bone interface. And isoechoic means it's about the same to what's happening around. And then there's this other concept called anisotropy, which is basically a property of being directly dependent on the ultrasound wave. So get to know this picture very, very well. As we can see, hyperechoic is that white line. That's the very bone interface. What's happening there is that the majority of ultrasound waves have been reflected back towards the source. So it shows as a very, very hot or white area. A hypoechoic area is the area surrounding that. So that's a little fat pad. So what happens there is the majority of ultrasound waves are reflected back, but also a good number of them are absorbed. So it shows up just a little darker. And then anechoic means there's nothing getting through, and that's what we see deep to that bone interface. So definitely make sure you understand this slide in those terms. Big thing to note here. Pause this slide and get to know this slide. When we're looking at a diagnostic ultrasound, the top of the image is going to be the most superficial layer, and then we're going to work superficial to deep. That is extremely important to know, because as we start looking at these structures, we have to understand that we're looking at a very small piece of a cross section. Okay, so definitely understand what is superficial, what is deep, what are those middle layers, and then understand things like fascia will show up different than muscle, and that'll show up different than bone. We're going to go over this a lot in the Blackboard Collaborate session, but definitely make sure you're prepared for that session by studying slides like this. This is another picture of an ultrasound, just to give you another idea of how structure can look. Take a look at that muscle. That muscle is hypoechoic in reference to the tendon. The tendon is hyperechoic. The cartilage is hypoechoic. The bone interface is hyperechoic, but below that bone, the subchondral area is anechoic. So start to look at these images, start to place and lay down those terms in that terminology on these images, okay? Because the better you understand how each of these images look on ultrasound, we're going to be better off. This is much different imaging, as you can see, than what we see in MRI or plain film radiograph or even a CT scan. So this is a normal flexor pollicis longus tendon. What we see here is we see a large area of white right in the middle. We can see muscle above that flexor pollicis longus tendon, and we can see a little muscle below. We also see where the skin is, and we can see where a little subcutaneous fat is as well. But what we're going to look for here in terms of pathology is obviously we're going to scan up and down that tendon, and we want to see if there's any chinks in the armor, for lack of a better term. We want to see, and we want to make sure that there's a continuity in that tendon. So you can already see kind of the advantage of ultrasound in the fact that we can view that tendon in real time and see if there's any sort of pathology.